She's back on with us, Dr. Janet E. Taylor, who has 4 daughters. So it's great to be talking to you about teens. How did you get involved in the teen aspect of domestic violence, Dr. Taylor?
Well, obviously I have children, but my practice is primarily community-based, and so I work in the Bronx with families, adolescents, and teens, and also with a lot of adults who have children.
I want to hear some of the stories, and maybe that, because a lot of times that helps crystallize things for us. What kind of stories can you tell us about what's happening with these teens?
Well, what kids and teens don't realize is that when we think domestic violence, we think it's just a physical aspect, but it's emotional abuse. And the number of teenagers, especially girls who come in and talk when you ask them specifically about how their boyfriends talk to them, and the feelings of low self-esteem, it's really heartbreaking. The other part is that domestic violence also includes sexual abuse in terms of forced sexual activity.
Yep.
And so when you really probe into the relationship and what it's like, how they met them and how they feel, that's what you find. And I think as girls anyway, sometimes it's harder to find your voice and to speak up. And so part of my practice is really getting young girls especially to speak up and not neglecting the fact that there are some girls who abuse boys.
How can parents identify that, though? How do we know as parents this is going on, particularly when it's sexual abuse?
Well, we have to start early talking to our young men and women about sexual behavior, what's appropriate, what's not, when you feel comfortable and when you don't. And sometimes it's not the easiest thing to talk about. However, there are medical professionals that you can take your daughters to. So take them to a gynecologist and make sure that, they're talking to them about sexual activity, or their pediatrician. Understand you don't have to do it yourself, and your kids may not feel the most comfortable talking to you, but at least put them in the position that they can talk to a healthcare provider openly and honestly and get real information.